Hi everyone, this is supposed to be Addy. We were supposed to meet this morning but he didn't come, so I've decided to exclude him from filming this video.
I'm sure I'm forgetting to do something today.
No, I'm just joking. So because of COVID related problems we're not able to film together this week, and we'll be filming separately in two different studios. Actually it's not studios, it's just our houses that we are using for filming.
This is Mohammed.
This is Addy, and this is the only place where you find two neurosurgeons talking to you about everything on the brain and spine.
In the last video, we talked about some of the common causes of back pain. In this video, we're going to talk about some of the other symptoms associated with it, some of the risk factors, and also which are the main symptoms that should lead you to speak to a doctor urgently. Back pain is often associated with muscular spasms. Spasms of the muscles are severe contractions which are involuntary. These spasms can be severe enough to lead you to be completely immobilized and can be a very painful cause of back pain flare-ups. In addition to muscular spasms, back pain can be associated with a stabbing, twisting or wrench in the pain, which can be exacerbated by movement. In addition to this, there can be also an element of leg pain, which can be experienced as burning or a dull radiating pain traveling from the lower back all the way down into one or both of the feet. Unfortunately, anyone can develop back pain, and there are 7 main factors associated with its development. Number 1 is age. Unfortunately, we have no control over this risk factor. As we age, the joints and ligaments in the spine degenerate and can often be a cause of chronic back pain. Number 2 is lack of exercise. Exercise is good for you for a myriad of reasons, but one of them is that it gives strength to the muscles in the lower back and your abdomen. If these muscles are weak, it can mean that there's undue stress in the joints and ligaments in your spine, and again, this can lead to the development of back pain. Number 3 is excess body weight. Similar to having weak muscles in the lower back and abdomen, having excessive body weight can put undue pressure on the joints and ligaments in the spine, and as this pressure is transmitted over time, can lead to the accelerated wear and tear of the joints in the lower spine and develop back pain. 4th is arthritis. Now, there are specific types of arthritis that can target the lower back. If you suffer from these types of arthritis, it can lead to the development of chronic and acute back pain characterized by flares of pain with the passage of time. 5th is improper lifting. Many people have jobs which involve lifting and placing objects down. If you bend your lower back and do not keep it straight, in combination with weak lower back muscles, this can lead to the development of back pain. Again, this is due to excess strain and stress in the joints and ligaments of the lower spine. 6th is psychological factors. Interestingly, people who are more prone to anxiety and depression are more likely to develop lower back pain, which is chronic in nature. This points to the fact that there is a psychological component to not only back pain, but many other forms of chronic pain syndrome. Finally is smoking. There are many reasons that you shouldn't smoke, but one of them is it is associated with the development of chronic lower back pain. Smoking is thought to be a risk factor for back pain because it reduces the amount of blood supply to the joints of spine, which reduces the amount of oxygen delivered to the joints and nutrients. Also, smoking is associated with the development of osteoporosis, which can mean your bones can become brittle and weak. If you want to stop smoking, please contact your GP for support and help.
As Addy just explained to you the symptoms of back pain and also the risk factors that can cause the back pain, I will be going through the 8 situations where you need to worry about your back pain and that you need to seek urgent medical attention. This list of symptoms is not supposed to scare you, but it's very important to recognize these symptoms and to seek urgent medical attention, because the earlier is better. The first symptom on this list is developing numbness around your genitals or buttocks. The nerves in the lower back supply the area around the front and back passage. If you develop numbness or tingling around these areas, this might mean that there is compression on these nerves, and this might need urgent medical attention. Second on this list is difficulty peeing. As I just explained, the nerves in the lower back supply the genitals and the buttock areas, but also it gives supply to the bladder and bowel. If there is severe compression on these nerves, this can lead to a problem with the urine control. This can be in the form of difficulty initiating the stream, or difficulty emptying the bladder fully, or difficulty in feeling the stream coming out. If you develop any of these problems with passing urine, you need to seek urgent attention, because this might mean that you have what's called a Kodak-Weiner syndrome. Kodak-Weiner syndrome is because of disc prolapse that can cause compression in the nerves in the lower back, and it's a serious problem that might require urgent surgical intervention. Third on the list is loss of the bladder and bowel control. As I just said, the nerves in the lower back give supply to the bladder and the bowel, and if that compression on the nerves is so severe, that can lead to complete loss of the bladder and bowel control. This means that the patient might wet himself and being unable to control the bowel itself. We will make a separate video to talk about more details about the Kodak-Weiner syndrome, how to recognize it and how to diagnose it and how to deal with it in the medical setting. The fourth situation on this list is developing chest pain. If you develop pain in your chest that is coming with your back pain, that might mean that you have a problem in your heart or an inflammation in the heart, and again, this is a serious medical condition. Number 5 on this list is if you develop high temperature or fever with the back pain. Developing high temperature with the back pain might mean that there is an infection happening in your back. This is again a serious medical condition which might require surgical intervention, or in many cases it might require medical treatment in the form of antibiotics for a long time. Number 6 on this list is unintentional weight loss. If you have back pain and you notice that you are losing weight unintentionally, this might mean that you have a tumor in your body that's extending to your back, which is causing you the weight loss. Again, this is a serious medical condition, and the earlier to recognize these symptoms is better. Number 7 on this list is developing a swelling or deformity in your back. As we explained in our first video, the back has a specific structure, and if there's a change of this shape of the spine, that can lead to back pain. This can be due to a congenital problem that you had when you are born, or something that has been developed over time during your lifetime. Again, it's very important to seek medical attention to understand if this is something that might need treatment or not. The final one on this list is if you develop back pain after being involved in an accident. If you experience a trauma or a fall, especially if you are an older age and you started to develop back pain afterwards, this might mean that you have a fracture in your spine. It's not always a serious problem in the back that you have a fracture, but it's very important to seek medical attention and see if this is something that can be treated with just a spine brace, or if it requires more invasive intervention like surgery. As I mentioned earlier, the intention of mentioning this list is not to scare you, but is to make you aware of the serious symptoms that can mean that you have a serious underlying medical condition that would require urgent medical attention.